Hey, 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 hey. It's a beautiful, beautiful evening here in the Shanty. And I know you're all asking yourselves, Palazzolo, why are you in the Shanty? Wasn't today the first day that we could actually go back to the office? And the answer to your question is yes, today was the first day that we could actually go back into the office. And MIOSHA actually confirmed that with rules about how we were going to safely go back into the office. Unfortunately, they did it at about 1 o'clock this afternoon. And we got some stuff up on the website that says the following. Update on MIOSHA emergency rules and draft permanent rules. Governor Whitmer announced updates to the Michigan Occupational Safety and Health Administration emergency rules. Under an amended set of emergency rules, MIOSHA will remove the requirement that employers create a, quote, policy prohibiting in-person work for employees to the extent that their work activities can feasibly be completed remotely, period, end quote. That's great news. We knew that already because the governor said it a couple of weeks ago when we hit the 55% first shot threshold under the My Back to Normal plan, which then all got blowed up by the CDC. MIOSHA goes on to say MIOSHA has updated other aspects of the emergency rules to reflect recent guidance from the U.S. Centers for Disease Control and Prevention and the Michigan Department of Health and Human Services, which will take effect May 24th. As I'm doing this podcast, that's today. Unfortunately, you're not going to see it till tomorrow because it's after 5 o'clock. So I apologize for that. And will expire on October 14th. Learn more about the changes, blah, blah, blah. So where are we? Where are we today? What do these rules say? Well, there's some significant changes in the rules in that all those industry-specific rules that we were following before that made the thing 15, 16 pages long, they're all gone. And we start out with a new set of rules that is a manageable 6 pages long. I'm going to be looking away from the screen a little. I know that's going to be funny. And when I do these, I glance away from the screen because, believe it or not, I don't memorize these things before I do them. I just sit down and I do them, which might come through in the production value and the quality of the production value. But, that's just me. I'm a spontaneous kind of guy. What can I say? So we're going to go through the rules together, which means I'm going to be looking away at my other screen, which is sitting back here, and I keep pointing at it, the Italian thing again with the hands. So here's the first thing you need to know. As I already told you, and as MIOSHA already said, these new emergency rules completely supersede in their entirety the previous emergency rules filed on October 14th of 2020, and then the one extension that was filed on April 13th of 2021. Completely supersede. And that's how we get from remote work where feasible to no remote work requirement anymore, because that remote work requirement was in the old rules, and the old rules are gone. The other thing that MIOSHA made clear was that if these rules are challenged in court and deemed to be invalid, we go back to the April 13th, 2021 rules. So the remote work rule would come back if we go there. Don't know why they felt like they had to put that in, but they did. Next thing they do in the rules is they make some changes to the definitions. All right. So what they've done here, what MIOSHA has done here, I think is pretty smart, is that they have broadened out the definitions to comply with what the CDC is saying the definitions are, instead of having a fixed definition. For example, close contact, instead of meaning someone who is within 6 feet of an infected person for at least blah, 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 they now say close contact is close contact as it's defined by the CDC in the guidelines at the time of the contact. So if that definition changes, the definition here would change too. COVID has changed too. It's now, instead of having a list of symptoms, we have a viral illness characterized by symptoms defined by the CDC. Suspected cases of COVID, we have a somewhat significant change in that it's a person who has symptoms of COVID that haven't been confirmed by a test, or an unvaccinated person who may have been in close contact with a person who's been confirmed through a diagnostic test to have COVID. So there's the first place we see a distinction between an unvaccinated person and a fully vaccinated person. We're going to see that more and more as we go through the rules. We now have a definition of fully vaccinated persons. It means a person for whom at least 2 weeks have passed since they received their final dose of an FDA-approved or authorized COVID vaccine. All of the 3 vaccines that we're using in the United States now are authorized. They're authorized by an emergency authorization, but they're authorized. So that would be any of the shots that we currently have today. All right, so let's get into the meat of the rules. First, we'll talk about your preparedness and response plan. Do you need a preparedness and response plan? The answer is yes. You still have to have a preparedness and response plan. And that preparedness and response plan now has to be consistent with current guidance from the CDC and OSHA, federal OSHA, not MIOSHA, which is not a change. But now that preparedness and response plan also has to be consistent with these rules, the rules we're talking about today, and that is a change. It's a small change, but it's a change. So you may need to update your preparedness and response plan. The next thing that we need to talk about is basic infection prevention measures for all employers. Okay? We're talking about hand washing here and facility cleaning and stuff like that. We still have to promote hand washing. We still have to supply hand sanitizer. We still have to require people not to come to work. But here's a change here. The old rule says the employer shall require workers who are sick to not report to work or work in an isolated location. The new rule says the employer shall require workers who are experiencing symptoms of COVID-19 to not report to work or work in an isolated location. We've got to now do our facility cleaning in accordance with the latest CDC guidance. Again, that's a theme throughout the changes of these rules. What about health surveillance? What about our screening protocol? Okay, you still have to do screening protocol. And what's interesting here is this rule says the employer shall conduct a daily entry self-screening protocol for all employees or contractors entering the workplace, including at a minimum a questionnaire covering symptoms. It's just blah, blah, blah. Same rules we had before, with the exception of this. The old rule ended by saying together with, if possible, a temperature screening. MIOSHA struck that out. No requirement of a temperature screening in this rule anymore. Okay, that is a change. And it might be a change for the better for you guys. The other change in this part of the rules is when you get a positive, you no longer have to call the local health department. You still have to tell people who've been in close contact, but you don't have to call the local health department when you learn that an employee, visitor, or customer has a known case of COVID. So that's a change. Workplace controls. Here's where we get into the vaccines. Okay? This is where we get into the difference between a vaccinated person and an unvaccinated person. Number one, you still have to have your safety coordinator, but they've removed the requirement that they be on site at all times. Okay? You shall ensure that any employees, except fully vaccinated persons, remain at least 6 feet from one another to the maximum extent feasible while on worksite premises. Okay? So, unvaccinated people, we're still social distancing. Vaccinated people, we don't have to social distance anymore. We still have to provide non-medical grade face coverings to our employees at no cost to the employee, but we're no longer required to provide non-medical grade face coverings to fully vaccinated people. So you can cut down on your supply of face masks if you want. The employer shall require any employee except fully vaccinated persons to wear face coverings when employees cannot consistently maintain 6 feet of separation from other individuals indoors in the workplace. That's the key to it. That's what you all were waiting to hear. That's what MDHHS said a couple of weeks ago. That's what the CDC said. That's the heart of it right there. Fully vaccinated people don't have to wear their masks anymore. Now, there's an exception in there if you work in certain healthcare centers, so keep that in mind. So if you're on a plane or you're using public transportation, people still have to wear their face coverings, even if they're fully vaccinated. But that's the exception. Now at work, if you're fully vaccinated, you don't have to wear the face coverings. Now, how do you ensure compliance with that? I know you're all asking that. How am I going to what am I going to do here? How am I going to ensure that people walking around without their masks on are actually fully vaccinated? How do I comply with this rule? Well, MIOSHA is going to tell you how to comply with this rule. Compliance with sub-rules 2 and 4, which is the social distancing and the face mask rule, of this rule may be accomplished in a manner deemed effective for the place of employment. What the heck does that mean? Don't know. But they don't stop there. They say this may include, and then they give you a list of 4 things you can do. Okay? 1, this is the most sensible one, it seems to me. Keeping records of whether employees are fully vaccinated persons and exempting them from sub-rules 2 and 4 of this rule accordingly. In other words, you get to ask your employees if they're vaccinated. If they are, they don't have to wear a mask, and they don't have to socially distance. If they aren't, they do have to wear a mask, and they do have to socially distance. And if they won't tell you, they do have to wear a mask, and they have to socially distance. You can post signs in the work area reminding employees that are not fully vaccinated to wear face coverings and maintain appropriate distancing. Think that's going to work? Honor system is basically what that is, right? 3, you can allow or require remote work. Now look, we didn't need MIOSHA to tell us that. You could always allow or require remote work. I don't know why they did that, but they did. And then the 4th thing, which is a little different. MIOSHA kind of gives you a pass here if you want it. They say you are allowed to require face coverings and social distancing for all employees, regardless of vaccination status. In other words, what MIOSHA is saying here is, if you want, as an employer, you can have a rule that says, we don't care what your vaccination status is, you're wearing a mask, and you're going to socially distance. Now, do you want to do that? I don't know. But they're letting you do that. And I suspect, again, they didn't need to tell you you could do this. You've always had the right to do this. But I think what they did here was they're giving you an out. So if you want to do this and employees want to complain about it, they can say, oh, no. That's in the rule. The employer is allowed to do that. Your employer is allowed to do that. So when they start getting complaints from people saying, I have to wear a mask and I don't want to, MIOSHA can say, hey, that's well within the rights of the employer to do. The next thing they do is they take that big chunk of industry-specific rules out. They're gone. They're out. All right? Then we get into 2 more requirements under these rules that you still have. One is a training requirement, and the training requirement is basically the same, but there is a significant difference in here that's going to require you to think about new training. Okay? You've got to provide training to your employees, and the training has to cover all of the following. Workplace infection control practices. That's the same as the old training. But now it says including information on vaccines available for COVID-19. That's not in the old training. Why isn't it in the old training? Because when we did the old training, if you've got our training, where you see me up there blabbing and teaching you how to put a mask on, we didn't have vaccines when I did that training. There weren't any. They didn't exist. Now they do. Now we've got to train on that. Proper use of personal protective equipment, no change there. Steps you have to take to notify if you have symptoms, no change there. And how to report unsafe working conditions. Again, the rule still says you've got to provide updated training if training changes, or if you change your preparedness and response plan, or if there's new information available about the transmission of COVID. The last requirement is record keeping. Okay? We've still got to do some record keeping. We still have to keep records of our training. We have to keep records of our health screening protocols. But now the rule says the employer shall maintain a record of health screening for each non-vaccinated employee or contractor entering the workplace. They took visitor out, added non-vaccinated. How does that match up with the earlier discussion? Well, the screening, according to the rule, has to be for all employees, but apparently you only have to keep records for non-vaccinated employees. Now, the third thing you have to keep records on is they say if you are proceeding under Rule 6.5a, that is, if you are going to tell fully vaccinated people, if you tell us you're vaccinated, you don't have to wear a mask and you don't have to socially distance. You have to keep a record of vaccine information sufficient for implementation. In other words, you got to know who's vaccinated and who's not. All right? And you have to keep a record of that. You have to keep a record of each notification required to close contacts. Remember, you don't have to tell the health department anymore. And you have to maintain records now for 6 months instead of 1 year. So that's it. Pretty simple and straightforward, right? And not so much. I'm sure you got a bunch of questions. And if you do, we're here for you. Give us a call. Call your Warner labor lawyer. We'll walk through this with you. We'll get you where you need to be. Have a great day. We'll see you next time.